Hi everyone, and Happy New Year. It's been a while since we did any recording for the SYT podcast, but we are back, and our first guest this year is a very interesting person from an organization I believe most of you have either seen on your Twitter handles or have seen news on it around tech news in Africa or in Nigeria specifically. So my name is Marin Mayenga. I am your host for the Spacia Tech podcast, and I have here Fred, who will introduce our guest after we do a little bit of catch up. So welcome, Fred.
Yeah, thank you so much, Mal. My name is Fred, the co-host with Mal, and this podcast goes behind the scenes with engineers, designers, startup founders, policy makers, students, and pretty much everyone in the African tech scene with something to tell Africa. So we are glad today to host the co-founder of one of the fastest growing startups in the healthcare space, that is Ogunyi. You're going to help me to pronounce this name, Tolulope from NGUVU Health. So NGUVU Health
Yeah.
is an on-demand therapy at the convenience of the client. So welcome to this podcast today, Tolulope. And you can just begin by telling us about yourself and about what NGUVU Health is all about and what you guys do.
Yeah.
Welcome.
All
Yeah,
right, thanks for having me, guys. And it's Ogunjuyigbe, and I know a lot of people struggle to pronounce it, so it's actually
I straightly went to Tolu once we started conversing because I knew I'd just butcher your name from the get go. So yeah.
it's fine. So Ogunjuyigbe Tolulope Raphael, co-founder and also like I lead the product team at NGUVU Health. I've been co-founder. Started with my friend Joshua Koya and also Juliet Odumosu, who leads more like the marketing team majorly. So interesting fact about the people behind it, right? So let me start with the people behind it before I move into talking about the company itself. So myself and Joshua have been friends for
19 years.
yeah, I think 21 years now, because we grew up
Yeah.
together in like the same community, more like an academic environment. One of the biggest schools in Nigeria, even in Africa, Obafemi Awolowo University, and both of our parents are professors, so more like academicians basically. So the original idea started with Joshua, and then I mean, he spoke to me about it, and I was asked to come on board. Then spoke to Juliet too. So interestingly, Juliet also went to the same school as myself and Joshua, but she's been like friends of Joshua for a couple of years, like 6-7 years. But I met Juliet like when we started building this product. So technically I've been Juliet's friend also for like 3 to 4 years now. So yeah, that is a bit about the founders.
All right. So were all of you in the tech space or the medical space, or how did this idea come alive? Was it from a personal experience? Because it's very specific to mental health,
Yes.
and mental health is not an issue that is it's usually spoken with hushed tones, especially in the African continent. It's not something we are very willing to admit to ourselves that somebody has a mental illness. And so how did the idea come to be? Because according to statistics, almost 50 million Nigerians specifically suffer from different mental health issues, and to be specific, 29 million Africans suffer from depression. But yeah, it's not something we're very willing to talk about, and even engineers are not susceptible to mental health issues, especially with since COVID came and working from home. There's been a lot of issues coming around depression, anxiety, and burnout. So, why especially the medical tech space? Why exactly mental health?
All right, thanks for the question. So for me, I've been in tech space for since 2016. I mean, I work as a product designer since 2016. Joshua has tried to create some innovations within tech, something in crypto, and he's always been a business person anyway. So Juliet has worked in like print and media basically. So I'm not far off from tech. So but the whole idea started, like I said, with Joshua, and that was 2020 during the lockdown, interestingly. So what happened was couple of personal experiences, right?
Yeah.
And then it wasn't. I think the COVID pandemic actually brought more like light or shone more light on
The
mental health.
dangers of mental, yes.
Everything moved into virtual. Like people started having like virtual parties.
Yes.
Uh, People started working remotely and all that. Then it became obvious, like, okay, people who seek therapy normally traditional way, like go to doctors, therapists in like designated hospitals and all that, couldn't like go out, because of like restriction in movement. And also Joshua started, because Joshua is more of like a people person, so he started
Mm-hmm.
like getting calls from friends, like just trying to share their struggles and
Yeah.
all that. Also like couple of like personal experiences. I also was struggling then, but
Yeah.
so at that time, if you had said it was mental health issue, I'll be like, nah, I'm just like stressed and all that, right?
Yeah.
So the
I'm just
truth
sad
is,
today. Yeah.
yeah, the traces were there, but I think really Joshua just came like, let us build something here, and he has been really be passionate about it for a very long time, right? And when he told me about it, I'm like, okay, you know what? We've tried to do a couple of things together. I
Mm-hmm.
mean, a couple of ideas that didn't fly, but when he spoke to me, I could see the passion, right? And
Yeah.
when he shared the idea, I'm like, okay, fine, let us try. So my response then was, let us try, right? Because in my head, I'm like, okay, maybe it's going to end
It
up
might
like
work.
the
It
other
might
thing.
work. Yeah.
Yes. So we
Mm-hmm.
started building. Not like building. We started thinking of how we can make therapy accessible to people during the pandemic, right? So we started manually. Then we got someone on board also who is actually like a practitioner and like a professional rather, right?
Mm.
So his name is Shola. He's a professional. Majorly myself, Joshua and Juliet, we didn't have any background in psychology or clinical psychology or whatever it is. So we
Yeah.
figured we needed someone with that training and with the experience. So Shola came on board. So he started serving as more like our go-to person whenever we want to like think of anything, like how to build, what to build, and all that, and also like making sure we're staying within the confine of like what is acceptable, like the standard for the practice and all that. So during pandemic we started doing manual. So people, we reach out to people, or people reach out to us, then we schedule the sessions via Zoom, right?
Mm-hmm.
So then we started onboarding like a couple of therapists also to work with Shola, and then I think we had like 5 or so therapists,
Wow.
right? So from there we start thinking of, okay, we need to make this thing more accessible to people, right? And really like understanding the problem. So it wasn't just like, we didn't want to start looking at, okay, let's just be the solution because we want to be the solution for mental health. It is more about how can we help people, really, like what are the fundamental problems with mental health,
Yeah.
right? So like, we start looking into what are the problems, right? I remember then we did a couple of surveys, couple of like polls, just to like understand, well, like really what are the fundamental problem. And for me, because I did the product team, that has always been like my approach to solving problems, really. Like I need to understand why does this problem exist, not just, okay, we've identified the problem, but why does it exist, right? So what are people opinions about it, right? So we did some couple of interviews, and also like polls and so then it became clear to us like stigmatization is part of the problem, right? So when people see you go for like therapy or something, they assume you're like mad, right? Like you're a crazy person, like mentally deranged person, which
Yeah.
could actually not be true, right? And also people see it as luxury, right? And for that, I wouldn't even want to argue it that much, because Africans and Africa generally is not like a very rich continent, and Africans are not like very like rich people. In terms of like disposable income available to them, right? So
Yeah.
when people, like, if you look at disposable income for Africans, 70% of it goes to food,
Mm-hmm.
right? Like first thing you want to do is eat, right? So you have little to nothing left to do other things. So if
Like
it is
go
not
for therapy. Yeah.
if it's not like a chronic headache or something where you have to go out and buy drug, or maybe you're sick and you have to go to the hospital, then it is not, they're not ready to like expend their
Spend money.
on that.
Mm.
So we started, it became obvious, like people started saying, oh, it's a luxury. People don't even like know where to also like get help, if they feel some type of way. People don't even know if they have mental health issues. So at that point, it was more of like we were able to like team our solution, like how the problems into okay. Number one thing is access. The number two is affordability. The number three is education. Right. So those are like the three major things that we start looking at. Like, okay, people need to be educated about mental health issues. People need to know when if they feel some type of way, like, okay, this is
normal.
What like you get. This is like what the problem could be, and all that. And also, how can we make it more affordable for people looking at like disposable income of the target audience? Then also like how can we make it accessible to people? Like someone in the remote village might not have access to like maybe the primary healthcare there don't offer that type of service, but they have a very good access to internet, right? So they should be able to see someone, a professional from the corner of their room or whatever.
Yeah.
Right. So those were like the three major things we set out to like solve and then I working on it. So that is majorly like the background and how we got here.
Yeah, that is a very interesting story, and also you've hit some pretty good facts there. Africans are not very welcoming to the idea of therapy or that they have mental health issues. Yeah, and also it brings healthcare to the click of a button or the tap of your screen, which is very accessible now, because in remote areas it's not really easy to go to a hospital and just say, okay, I'm here for a counseling session or to see a psychiatrist. Yeah, it comes with a lot of stigma. So yeah, that is very interesting. Fred, do you have any questions?
Yes. So thank you so much for that background, Tolu. So my question is, it is very interesting what NGUVU Health is doing. In fact, when I was thinking, when Mal told me about NGUVU Health, I actually thought that NGUVU Health is a Kenyan startup. So, and then I checked the founder, and I found that he's called Joshua Koi.
Koya.
Yeah. Yeah, Koya. And I was thinking, is this a
Kenyan, Nigerian?
Yes,
Kenyan name.
yeah.
Right.
That was yes, very interesting. I had to say there.
I have an interesting story about that anyway.
Yeah.
That's how it came. So I'd say for I mean when he told me about it, like the name, I'm like, okay, interesting. But for then the thinking for us was more like this is a solution coming from Nigeria, but it's Pan-African, right? So majorly like people outside of Africa, right, can have access to it. So Africans living in Africa and outside of Africa can have access to it. So and you would agree with me that Swahili is probably the most spoken African language, right?
Yes.
So like it was more around around like the name, the branding, like what can we use to like make sure people understand that it's Pan-African. When you see it, you don't necessarily see like a limitation there. Maybe this is just for like a specific space or something. So we had to go with like the most spoken language, and then we're looking like something that could like when people who understand Swahili or people who need to explain, so when they hear the name and the meaning, they know that okay, yeah, it's in a way tied to what the brand stands for. So as NGUVU strength, so we're trying to majorly just tell you that okay, we're trying to give you mental strength, right? So we're trying to help you be strong mentally. So that is how the name came about. So I know most people ask like, why did you get the name and all that? So like yeah, we're just trying to adopt the most spoken language in Africa, and also like make sure it means something to whoever is like we're going to explain it to also.
Yeah. That's very interesting. And when I'm thinking about the access part, and when I saw the name, it just clicked that this is something that a lot of people in Africa, particularly in East Africa, would relate to. Just from the name itself. And then I also like the logo because I can see it. There's an account with it here. The logo is so cool and so clean and meticulous. Congratulations, guys. So
he's a designer, so I'm sure.
Yeah.
Right. So the everything about us is very intentional, right? I mean, from how we build for how we even brand ourselves, like the communication, like marketing and everything, we're quite intentional. So this new logo you're seeing came about last year April, like when we celebrated like 1 year anniversary, and we
Mhm.
just wanted to depict people like getting help, someone getting help, so more like a client speaking to a therapist, right? And
Yeah.
I mean, if you've gone
Yeah,
through that,
yeah, I can see it now.
There's
You
a
know, I
chat.
thought it was a smile
It's a
of a
smile, and then
person. Yeah.
it has a chat inside.
if you
Yeah.
notice, you see like two
Yes.
people sitting and then having a conversation.
Oh,
And
yeah, I
if you
can see it now.
yeah, if you explore the application, like on your splash screen, you would see like moving animation. I mean, an animation rather that shows like, oh, you kind of like have a low bar, then you start speaking to someone, then your bar start going up, then images to form the logo. So it is very intentional about us because communication and language is like in branding is super important, and we want to communicate the value properly also.
Yeah.
Yeah, on the accessibility part to Lulupe, I'm really I want to dig in and ask about the platforms through which the
Mm,
services of NGUVU can be accessed, and one of them is I know is web, and the other one
mm,
is an app. But
Android.
you see, yeah, but you see in Africa, like USSD is still very common because feature phones are still quite widespread, and smartphones, the penetration of smartphones is not that deep yet. So what about let's say like somebody like my grandmother in the village who maybe needed therapy or not, but like
The
wants to
education
access,
aspect.
they wants to access the services of NGUVU Health. How would they go about that? Do you think about that angle?
yeah, so I think you kind of agree with me that you can't possibly like build everything out at once, and majorly it's just about us identifying what could be like the easiest. So on Google right now, it's just like one face of like what we have presently is just like one face of the solution we're looking at or we're thinking, I mean, tending towards, right? So right now it's more like preventive, and I kind of agree with you, like, okay, fine, maybe for older people or for people who are not, I mean, accessible, don't have access to like mobile phones. Maybe there could be something. Yeah, we started thinking about it. For now, it's just like mobile application. In fact, I don't think we have a solution for web yet, which we are going to be launching. We have a solution we're building right now for web, which are going to be launching later in the second quarter. For now, it's just like the mobile, which you need access to like a very good smart device, and also like for access to internet, right? For other ways we could like also like give people access like USSD and all that. It is about, first thing is about when we expand or when we start looking at other means of how do I put it, other means of giving access, right? For USSD now, we need to create, like, we need to explore the use case properly, right? And also how can we build for it? So looking at Nigeria now, like USSD is not that big. In East Africa, I know it's quite big with its advent of like mobile money and all
Yeah.
that, right? And but in like the primary market for now, it is USSD is not that big. So I mean, we already started thinking of East Africa. In fact, we've been there like couple of times, especially Rwanda, a couple of times last year. So we started thinking of the market already. So when we are like fully ready to move into that market, yeah, we definitely consider USSD. Like, how quickly can you get access without, even if you don't have a smartphone, like how can you get access to it? We haven't on for now, we haven't like thought about how to build it out, but I know it's something we start looking at like towards this year. And really, we don't want to leave anybody out because mental health doesn't really care about your position, about your age, about your financial status or anything. So like everybody, so far you're alive, right?
Yeah.
You need to really take care of your mental health. So we don't want to leave anybody out. But right now is majorly, it has to be strategic for us, right? And we have to look at the market we're moving into and what is obtainable there. Like, what is the major means of using a service there, right? So definitely we'll be moving to East Africa. They start thinking of USSD and all that, like, or maybe we could even partner with existing service providers there and then do some things and all that. So we, like, that way we don't even necessarily have to like build out a solution, right? We can just, I mean, expose our APIs. Work with service providers there, and if there aren't any, then we could build out leveraging the existing infrastructure there also. So really, like I said, it's majorly about expansion, right? So wherever we expand to, we look at what is the most used service there, and I mean, how can we plug our service into that and give people access?
Okay, interesting. So you have spoken of the different that is in the future plan. It may not be exactly in the pipeline at the moment, but it's something you're thinking about. Is there any development or future plans that are already in the pipeline that you are allowed to speak on at the moment? That
Yes,
you
yes.
recently, yeah.
Interestingly, we tried to. I know I hear some couple of like some of our solutions. Since we've adopted Swahili, so I mean, as our language for like naming our product, we have a product we'll be launching sometimes in April called Rafiki, right?
Ah,
So yeah, called Rafiki. The way it works is you can have access to, but I mean, solely targeted towards more like students, like high
mm-hmm.
schools and universities, right?
Yeah,
So you can
yeah.
have access to mental health services from your WhatsApp, actually. So more like you're
Oh,
chatting with a bot. Yeah.
it's a bot.
So yeah.
Yeah,
So we are. I mean, at the same time, it's still like using our APIs and our like resources. So it doesn't, as much as you're chatting with a bot, you still get the help you're going to get still. And majorly, we're looking at that just to give access to students, really, because and you would agree with me that students are not, in terms of disposable income, not like people who have a lot
at-
compared to people who are
yeah,
working.
yeah,
So and
yeah,
like I said, everything is strategic for us. With the markets we're looking at, the people we are looking at, also like the audience, how can we give them access? And even if we give them access, how can they like be able to afford it? Because remember, I said at the start that affordability is also one of the things we are solving for, as much as we're solving for access, right? And
yeah.
so Mid Rafiki is channeled for like more like high schools and also like people in the uni, right, universities and all that. So yeah, it is going to be launched I think April, yeah, April, because we are already at testing that out. And I mean, it's going to be interesting, right? Maybe after this call, if you want to test it, I
I
can
would
give you
love
access.
to. Yeah,
I can give you access to that. So
let's
yeah,
do
we'll be
that.
launching that. And also we're looking, as much as we are providing a solution for people, we're also looking at how can adoption be super fast and great also. So we are looking at building a couple of like B2B solutions. So
Mm-hmm.
some things like automating like mental health audits for companies. So we started like building that. That should be ready like second quarter of the year, sometimes May, June. We should be launching that also second quarter of the year. So those are like what we're currently working on. Also, we're using like an updated version of what we have presently, and that includes like some features that will be coming out, like traffic light feature, um, couple therapy, in group therapy, and all that. So, yeah, a lot of things are coming in from April to June, and I would say you guys should watch out. Towards the end of the year, we'll be launching one of, like, I would say like a very interesting feature. So more like we'll be doing like a pilot phase for that. Just something to test with and see viability. Although it is targeted for Africans and diaspora, and majorly we're just looking at, like I said, it's kind of, we have to look at business side also. So something in VR tech and virtual reality. So yeah, we start looking at that, and maybe sometimes in December we should be launching like an MVP for that also. So a couple of interesting things coming this year, really.
So
And majorly is
how the VR
majorly.
look like?
Mhm.
How will the VR in terms of mental health accessibility look like?
So what we want to explore really, so the situation we're looking at is how can, like, there's something called in situ coaching. So in situ I mean, it's gotten from in situation, like, so it's kind of like I think it's kind of like popular. So in mental health, so in situ coaching rather. So majorly like um we are looking at I mean, how can we plug these services into like wearables, like VR headsets and all that? So that means from the corner of your house, you could have like virtual sessions with your therapist. And I mean, if you have like situations you need to do, maybe like, for example, you're suffering from anxiety, right?
Yeah.
Maybe in like, you go to like supermarkets, you suffer from anxiety, like maybe crowded places. So with this institute, right? Um, you could use a VR set to actually go to like a supermarket, right? Then you still have like your therapist with you, trying to tell you things to do. So you don't necessarily have to have a session, then maybe go and do that thing, and then come back to your therapist, and I mean they will now tell you things to do. But right on while you're on that call, you could do everything virtually, right? Like go to public places you don't want to go to like what's it called, supermarket, anywhere. I'm just giving like a sample use case, right?
Yeah.
That you then right on that call you can get help, so your therapist can see you in action also. Then they can advise you on things to do right on the spot. So we're looking towards like called in-situ coaching. So like I said, this is more like in situation, right? Coaching for that. And there are other couple of use cases we could explore, but because for us that start from like middle of the year that would start exploring and building that out. So for now, that's like the only use case we've identified. Also, we're looking at sometimes next year, we're looking at like wearable solutions, right? So the way you use your watch, right, to track and when you run, your blood pressure and all that, majorly just keying into like available what's it called, available infrastructures provided by like the likes of Google, Android, and Google and Apple rather. So majorly the way you could use your watch to track your running, your blood pressure and all that. Maybe you could use your watch to also track your state of mental health and all that. So it's something we want to explore from next year. I think we actually have a calendar for it from like January next year also. So couple of futuristic solutions we're looking at.
I'm
And
excited to this.
yeah, nice man. So I just want to ask a question in general about the general environment or the general industry, the health tech, environment in Africa. That you health tech has to start from like so far. Unlike fintech where there's a bit of regulation here and there, there's a bit of infrastructure. You find that health tech has to start from so far, and there's so many challenges that I believe that you guys have encountered in building up NGUVU. And you kind of mentioned about the data collection, for instance, that you had to go to the very ground and interview people and do all these things just to get the data that you needed to build some of the products that you guys build. So where are the challenges that you see presently from where you sit as the co-founder of NGUVU? Where are the kind of the challenges in healthcare that other founders you think are encountering, or you think that somebody who is planning to get into this space is
So,
likely to encounter, and
so
how they can work around some of these challenges?
right. Thanks for that question. As for every sector, yeah, you always have like challenges. So for health, precisely mental health, I would say um um I'll pick it in layers, right? So let me start with people itself, right? So because people could be a problem, especially when it comes to like health. I know that like you are in healthcare, you're literally competing with a lot of traditional religious factors, right? And I mean, people who are sick, could go to their pastors for prayer or something, or they could go to local herbs people and then get herbs and take out. It could work, right? No disputing that also. So for mental health, it's even like crazier, right? For mental health, you're competing with um with same religious and religious factors also. Like people would rather speak to an elderly person, or speak to their friend, or speak to pastors or something and pray it away. I mean, it's fine. It's more like combination of everything. It's not like there's a one size solution for everything, right? But at the end of the day, you still need to like speak to a professional, right? So there's that's let me just say social challenge, right? So it comes with people educating people around. Nobody's stopping you from praying to God. Nobody's stopping you from speaking to people. But at the end of the day, you still need to speak to like a professional. So you're competing with that, right? So you're trying to now educate people, because education is like number one problem actually. I would say, and now trying to like educate people on why they need to like seek therapy. And for us, it's even like very interesting because when we're building this, right, we figure that yeah, people want to go for this, but they don't even know like what they need to go for. Like people see therapy as cool, like cool, like oh, it's just for the cool kids or for the rich kids and all that, right? So
Yes.
what we did was we started, um, I mean, a lot of like campaigns on social media, like trying to educate people on mental health challenges. And also, like with the products, we did something quite interesting with the products, such that initially we felt, okay, let's do like a couple of resources, like let's just give people articles to read about mental health. But part of our testing session, we figured that people wouldn't read articles. People wouldn't read 6 7 minute articles, right? So at the end of the day, it's still not like productive. They are not still trying to, it's a good idea, but you're not solving that particular problem of educating people. So what we did, we switch our approach with the help of our lead therapist Shola, and we switch approach to creating like a free assessment. So what we did was we created like what are the leading mental health problems that people could have. So I think we identified like 8 of them: depression, anxiety, PTSD, substance use, alcohol use, adult ADHD recently, then acute stress and mood disorder. So we just created assessments around them, and it's totally free for people to use. Right, like come in and use it. So when you do that test, but one thing we're extremely careful about is telling you that this is just suggesting to you, doesn't mean you necessarily have that. But like for each score band, this is what could be happening to you. It doesn't mean this is what's happening to you. This is what is happening to you. So we don't want you to take that result and go and like just to say, oh, I have this problem or I have this challenge. No, you don't. But it could be that you have that challenge. That is now where you need to now speak to people. So, and one interesting data from that is that since we launched that, we've gotten 10,000 tests taken. Yeah, over 10,500 tests taken. And I mean, the leading tests were alcohol abuse, anxiety, depression, and PTSD. So people are actually like using it to understand before they even speak to a therapist, like, oh, could I have this problem? And then from there, they start seeking help, right? So that is a way we're able to like, I mean, one of the ways we're able to like, you know what, people need to get educated. So the social challenge and the education challenge is there. And for as like every sector, you need like supporting infrastructure, right, from like government. So for fintech, you have like couple of infrastructures from like CBN or like public and private partnership. Like for Nigeria, there's NIBSS for like payment settlement and all that. But like you would know that government is actively invested in that part, right? For mental health, it's just, I mean, for health generally, yeah, they're like we have Ministry of Health and all that, but what are the infrastructures available? Ordinary, like to get some simple data on I mean key things was like really difficult. So you have to go to the World Bank and then or some organizations that have like outdated data, basically. It is until recently that the Nigerian government even like signed like updated their signed a mental health bill. That was like January this year. So you would see that you would face challenges around even regulation, right? So mental health is not really like regulated in Nigeria. I mean, Africa also. So for Nigeria now, we don't have like a regulatory body. So even if you're trying to look for like therapists to work with, you have to go and source it yourself. So you have to go through like LinkedIn or just like speak to people, like their network of therapists. So sourcing therapists is quite difficult, and majorly because not that there aren't enough like therapists also. I don't know much about the ratio, but like it's I mean, I don't want to even think about it. It's really crazy, right? I mean, healthcare generally, like number of medical practitioners to like citizen is crazy already. So now imagine what it would look like in mental health. So sourcing for like therapists is difficult. So what we did was at NGUVU was to set a like a standard, right? So the criteria for you to be a therapist on a platform is that you should have at least a minimum of MSc in psychology or clinical psychology or something related to like that could let you practice as a psychotherapist, right? And also you must have at least 2 years of working experience. So that we don't just want to be extremely careful, because also as much as you have professionals, they're like a lot of counselors who are not necessarily people who could like help people with the mental health challenges, right? So we just, since there's no regulatory body to, or there's no examination of whatever they need to do, we just have to make sure like we set that standard ourselves so that we can attract like, okay, the best people who are actually capable of providing value to the client. So, and also because for us, the users are not only the clients, also like the therapist, our clients. So one of the things we're trying to do is to make people see like, I don't know why people frown at studying psychology or stuff like that in school. If I'm to go back to school now, I'll definitely go and study psychology, right? I mean, majorly because of what I've seen in my field as a product designer, also like what I've seen as being a co-founder of this company. So there aren't enough therapists out there. So we need to find a way to like encourage people to, study psychology so we could have more psychotherapists helping also. Then, funding is funding is like a major thing, right? So but we can't complain. I really can't complain much about that. We've been doing fine and we're still doing fine on that. So maybe government could be well invested in it. I think part of the main thing in the mental health bill for Nigeria that was signed recently was like establishing like a new mental health fund and also creating like a mental health department in the Federal Ministry of Health. And so maybe that could in a way bring some sort of like visibility to that to this sector, and also like maybe more funding that other people coming into this space to come and like innovate could access. Right. So those are like a couple of challenges we faced, and it is not really an interesting, it is an interesting feed, but it is not like fancy in a way, because you have to do a lot of you have to dig in deep. Like you have to really, really be innovative and think of creative ways to like build a solution. And also considering the people, it's more like there's a knowledge shift now, so people are like now accepting or like looking into mental health, so people are now like paying for mental health solutions and all that, right? And also one of the things we set out for, like I said initially, was the data problem. So like we at NGUVU are looking like to be like a data bank for anybody that wants to come to that space. Like, oh, very soon we're going to be releasing a report anyway, stating like state of mental health in Africa. So that's just based on data we've gotten over 2 years, and also maybe at some point we're happy to expose the numbers and whatever to people, so that they can use that to like make like maybe like business decision, product decision, and all that. So yeah, those are like the major challenges.
Wow, thank you, Mal.
Oh yeah, so I saw you were talking about going to Rwanda last year, and I was just looking for information around, and I saw you guys were there for the Google for Startup Accelerator program, and you were just talking about the challenge you've had with funding, and at the beginning of starting the NGUVU Health, you guys, it was a self-funded organization. Yeah, so for the first maybe 4 months I saw you guys, it was the guys who saw the future, or were with you in seeing the value and the dream of NGUVU Health, stayed. So how has that journey been 2 years in?
I'd say, look, 2 years in, looking back, I mean, it's been pretty interesting, right? We've had amazing advisors and backers, I would say. So more like angel backers, really. Investors, we call them in tech space or investment space. Great people like former like founder of Jobberman, where I would, and some couple of guys also. And Google for Startup for us was really great. We got in 2021. Yeah, we got in 2021, and we're part of like 16 startups for this 16. I'm not really sure of the number again. Yeah, and I mean that really changed a lot of things for us, because we had access to, I mean, we started having access to people and resources we wouldn't normally have access to if not for the program. So like that really helped with the way we started like thinking, with the way we started building, with people we're even speaking to for funding also. Also couple of businesses we've closed. I think that came through like relationship with people from that we had access to from what's it called, Google for Startups. And I mean that really helped us. From there we got into ODX also. So ODX on deck, there's another accelerator, ODX on deck, which is quite popular. That was last year. We got into that last year, and I mean that was really fantastic, right? And that gave us access to a lot of, I would say, majorly for investments, which we're yet to like start exploring, but like whenever we're ready we could start exploring that. For us really, it's not about raising money, it's about the people. Like we really care about the people, and we just want to build product that is offering value to people. And really I would say we have like first mover advantage, right? So a lot of, I would say maybe like there are like players in this space already. I think there's Wazi Health in Kenya, right, who are like quite big too. Maybe the approach is more like B2B, while ours primary for now is like B2C. But I mean, a lot of startups are coming up now. I think recently this year, between November and this year, like 3 startups of our startups already launched. As at yesterday, one launched also, which is great. Like we want more innovators to come into the space. We want more people to come into the space. And I mean, I wouldn't want to say, oh, it's majorly because of NGUVU, but because people started saying that, okay, mental health is important. So more people will come in. As more people come in, different ideas on how to solve the problem would actually be created, which is great. Some competition like helps, right? And also, maybe more investors into that space. But for 2 years for us has been really fantastic. Sometimes we look at the numbers and we're like, oh wow. Because majorly it's been through so much grit and so much I wouldn't call it suffering, but like just putting in the hard work really. And yeah, 2 years in fantastic, great. We've gotten to like great places. We've closed like great deals also. Currently we have like working with the biggest HMO in Nigeria, that's AXA Mansard, and we have like a 2-year deal with them and a couple of organizations also. So it's great really.
Yeah, wow, it's very interesting. I'm very interested in how an idea starts, how it spawns until it gets to that level where you guys are seeking for funding. And the way I want to frame this question is, there might be someone else with an idea like NGUVU, like they had that idea like NGUVU even before you came up with that idea, but they've just been hiding it in their closet, working on it, and then looking at it, and then where will I get the funding for this thing? Tolulope, what do you see? What kind of startups do you see getting funded? Because in the health tech space, for instance, there are like over 50 amazing health tech companies in Africa at the present which got funding to the tunes of millions of dollars. So when you're just advising someone as a startup founder, what are some of the things that they need to get right, for their idea to be quote unquote fundable?
Yeah, this is a very personal question for Fred, so you would love to get an answer.
So for me, really, the advice I'm going to give anybody, it is important that one thing is, as a founder, right, you get your partners. You make sure like you work with people who you can really like work with, not just like yes people, right? People who you like challenge each other ideas and all, right? So first thing is get your founding team right. And for us, because the friendship is there, we disagree a lot, but at the end of the day, we stay like the main focus is what we're trying to build, right? The value we're trying to give people is the main focus for us. So get your founding team right first. Second thing for you is also get your like people who are going to work with you. So for us, it's actually like we got a lot of like people who were willing to work for us when we started, right? So, and I mean, you have to learn to like, you have to take a bet on people. Funny enough, because for my team and for like marketing team, one of the guys working on the marketing team was as at last year. Okay, so he became a medical doctor last year. He was in the university, so we just took a bet on him. He just woke up to us like, oh, he would like to work on these and that on like with us, and he gave us like, oh, this is experience and all, right? And we took a bet on him. We could have said, no, you're still in school, like when you're done and all. Right, so we took a bet on him, and right, really that paid off, right? I would say what some of the fantastic work you're seeing on like with social media and all that was like down to like that team, and I mean most parts him also, right? And for my own team, like I worked with I wouldn't say like not a lot of senior people, right? But I just had to trust them. And I mean, you don't trust blindly, but you could see that this person have some. So you have to be able to like spot talent, like, yeah, and you have to like really take a bet on people. You don't have to wait till you get $50 million or anything. Like you have the idea already. So just like leverage on your relationships with people and start building something. And also like you need to be honest and transparent with them also. So like from there, once you get the founding team right and people working with you right, then you can start building. So you don't just build blindly also, right? So I think that's like a mistake a lot of people make. They make it majorly just want to build because so maybe you're in love with that idea, but it is important that you understand why. Right. So why are you building? Like, okay, the problem exists. Why does the problem exist? I mean, along the way, you could even discover like maybe what you're thinking as a solution to a problem you're looking at. It's you could discover something else along the way. Like when you try to major like just do your research and try to like speak to people and understand why that problem exists. So I always tell people if you're building something, start with why does it exist? Right. So it's from why you now take it up to how can you now solve for the why. Oh, like your car is not moving. You don't just solve for your car is not moving. Why is your car not moving? Right. That is how you get insight into what the problem is. And from there, like you understand the problem, you have like your solid team already. Just keep building. Right. And you need to be able to like speak a lot about what you're building. So for me, I'm more like I think out of the founders, I'm possibly the only person that doesn't speak much, majorly because I'm not just a very public like person like that. I mean, you hardly know me on social media or whatever it is. Even if real life, you hardly know me. Most of the time I just want to be my own. But my other co-founders, Juliet and Joshua, they are very like vocal about what we're building. Right, they speak a lot about what we're building. For me, it's just let's build right. Like majorly maybe because of the team I'm leading, right? I have a lot of issues, complaints from customers I know that I need to fix and all that. So but like you need to make sure like out of you guys speak a lot about what you're building. Like there's no enough okay, you're shouting like yeah, keep shouting about what you're building and let people see the value. Even from when you start working with like people in your like people you're able to like start the whole idea with, you need to show them like the value. People need to see the passion really. People really need to see the passion as the founder or co-founder, whatever. People need to see the passion. People need to be able to connect with you as a person or even with an idea. Right. So I think that is one of the things that's worked for us now. Like we've aside if everybody on our team today we ask them like, oh, we want to go and build something entirely, I can assure you that all of them will follow us to go and build that. They will follow us because like we've connected, right? So you need to like connect with people. You need to have a solid team. You need to understand why. See, people like your customers are like, or your users are like the most important people. Funding may come, right? But like people are going to pay for your service. So you need to focus on them actually and like build for them, right? And I mean for us, that is what we've been doing. That's why we haven't done like any major raise or something, because we're just really like concerned about providing value. And funny thing is we've gotten people reach out to us, they want to invest and all that. Yeah, we've taken some and we've like we decide not to take some and all that, but like at the end of the day, it's about how can you be when you start building your idea, when people start paying for it, you start looking at sustainability, right? You don't want to build your startup because you want to keep raising money from people or investor or VC, right? You want to be able to like be self-sufficient. So sustainability is important too. So how can you build an idea from like to a business that people are paying for, that you're able to cover all your costs, right? And also like maybe invariably generate profit and all that. So yeah, those are like the most important thing. Get your teams right, get your team right, get your funding team right, um, build for people, like that's like create value for people, like just solve their problem really, and then find a way to monetize it.
Interesting.
Nice.
Yeah.
Yeah, I just want to follow up with a question about the business model of NGUVU, and it is a B2C, and we had a guest some time back. I think it was on the spaces. In fact, it was Chimoni CEO, and he talked about the B2C versus the B2B model, and he advised founders especially to really focus on B2B. And I think I saw from your website that I think there's that product for organizations where you could be offering services to organizations, meaning companies. Where do you see like where's the sweet spot? Is it the B2C or the B2B, and which are the challenges of both, so that a startup founder can kind of weigh between the ideas that they have, which one could make more sense, in a kind.
No, really, I would, to be honest, I'll say B2B, right? But then it also like depends on like the sector you're playing in, right? But overall, I'd say like B2B majorly, because I mean, companies could afford to pay, and also B2B is even like super great because you're not only just acquiring like, for example, in healthcare now, like healthcare really, like you're not only acquiring users, you're also like getting like money, right? So for example, for us now, B2C, we are servicing, currently we have over like 14,000 users, and I think like 7,000 active users, right? Excuse me. And when we start speaking to like companies, right? Some companies have over like 30,000 staffs. So if we close that, and when we do, right, we get to like acquire 30,000 users, and also like get a body to pay for those services. So like B2B is great because you get to not only get money, like, and also you get to like users, but at the end of the day, like really you need to understand the sector you're playing in. And B2B is challenging because it takes time like to close like deals. One of the major deals we closed took over a year before we could even like close that successfully. We've been on some that's taken like 6 months. So it's a very sweet spot, and it's also a very crazy spot because you need patience. A lot of people are involved like in that process also. So it's, but like I said, at the end of the day, you need to understand the sector you're playing at. There are some maybe products that wouldn't necessarily require like B2B. If you're able to like find a B2 creative way to like create like creative way to get a solution for B2B, fantastic. But B2B is super crazy, and it's like the sweetest spot really, because you get to make more money from that, and also you get to acquire like more users, especially in healthcare. It takes a lot of time to close B2B deals. God, it takes a lot of time to take. So you need patience. As much as you need patience, you can't also let like your company not keep growing, right? So B2B sweeter spots, but it's also like the craziest place. Like I don't like I don't like I don't like B2B at all, right? I like the benefit from it, but speaking to companies can take such a long time also. So yeah.
Okay, Fred, I hope that question is answered. It fully depends.
Yes,
Yeah,
very
it
much.
fully depends on the playing field that you're on when you're starting the business. So as we come to a close in the podcast, I have I think one final question. What role do you think NGUVU Health will be playing on the health ecosystem in the African continent and further? And what do you envision to be the future of NGUVU Health in the health sector or health space in the African continent?
I'll say I think I've touched points on some of them, right? I think for us it is we just really want, from what we've done, we just really want more people to like come into that space. I mean, individuals, businesses to come into that space and innovate. People need help, right? At the end of the day, everybody, we need to do it for people need help. Like people really, really need help, and one company won't be enough, or one idea, one startup won't be enough or something, right? People need to come in, and that is one of the things we've done with NGUVU. We've made it like obvious to like people, and like people want to move it. Like, yeah, it is doable. It is not easy. In fact, it is extremely hard, but it is doable, right?
Yeah.
And yeah, so that is one thing. And we're not only looking at Africans. Like I said, our product is for all Africans, regardless of your location, right? So we're not only just going to be like preventive at some point, we're looking to be like corrective also. That is what I was talking about, like our VR solution and our wearable solution coming soon. I mean, I'll be looking at launching sometimes later this year, I mean next year. And yeah, so and for governments, really, we hope with startups, more startups coming, more ideas coming into that space, we hope we're able to like be able to make contributions to like policies around like mental health, really, because individuals are very important in like policy decision making and all that. So yeah, we hope we're able to like influence government decision. We hope we're able to collaborate with government also on like formulating policies around mental health. Also, like I said, for NGUVU, we want to be like a data source for everybody that wants to come into that space, which is something we've been building for 2 years. We're going to, like I said, we're going to release like a report in April on that. And so, yeah, this is to anybody that wants to come into that space. If you need data, and maybe we're happy to help you with that, yeah, we can. Maybe we can. I'm not commenting anything on the podcast, but yeah, that would be like dependent on conversations outside.
Yeah.
I mean, whenever you're ready. But yeah, we plan to do that, and really, we have like a wealth of data now over like 2 years. So yeah, that is also something we're looking at contributing to the system also. And here, anybody that wants advice can reach out to me, can reach out to any of our co-founders. We're happy to discuss that. Even if you're trying to do the same thing we're doing, and you're trying to like create something entirely, I mean, this solution in this space, yeah, we're happy to give like advice. We are also happy to like collaborate. So we are very big on collaborations. Most of our like payments means we've worked with LaserPay, who helps to like settle payments in crypto. So like for our service can pay with crypto. So I mean, we collaborated with another startup who like launched almost same time as us, or like a year after, right? And also we have like Pair, where you can pay for like if you have an existing wallet, you can pay with some Google. So like if you have money in your bank, maybe you have money in Eversend, I think, yeah, you can make payments. So like they can help you connect like your wallet and make payments basically. So like we are very big on collaborations and all that. So yeah, if you want to collaborate, yeah, we are more than open to discuss that also. So yeah.
Yeah, we are looking forward to. We have a community of over 10,000 software engineers. We are hopefully looking forward to collaborating with you on offering affordable healthcare and mental services to our engineers, because sometimes it can take a toll on us, right?
Yes, let me speak on that. Also, like we work a lot with communities, right? I think we have like few collaborations with some community, like Koala, that's Covenant University Alumni Association. We have Ladies with Balls. We have non-tech people in product. I can't really remember the name. Like, yeah, we have like collaborations, fantastic collaborations with like communities also. And these are communities like great numbers of people, right? 10,000 upward and all that.
Yeah.
And yeah, so we're always like working with communities. It's one of our approaches also to like growing like the user base, and also like spreading the importance of mental health, and also like helping people like access the service also. So yeah, we work with a lot of communities. So we're happy to like speak with communities and also like work with them.
Oh, nice. We will invite you to one of our spaces on Twitter so that you can speak to the community on why healthcare, mental health care is important, and how they can be onboarded on your app and get affordable services, healthcare services. But I'm looking forward to see the different future developments that you have. I have the app on my phone, but I usually just go there to check up on updates and all that. But now with all the future plans that you have, I think I'll be spending a little bit more time on the app and see what you have there.
Yeah, watch out, April. We are launching a couple of things in April, towards the end of April. So it's going to get really interesting. We are trying to give people a lot of access to a couple of tools that they could make use of and on the application. So I mean, I can't just reveal everything here, but watch out in April. It's going to be really interesting.
Interesting. Yeah, we will definitely be doing that. And I hope from everything that has been talked about today, people have a better outlook on what mental health is. And you spoke about psychology being taught in schools, yeah? Having more psychologists to speak on mental health and also help people with their mental health illnesses. I'm not sure how that will be taken by African parents, but hopefully as more information is being desensitized, many people will also have a positive outlook on mental health and how to identify and also be on the lookout for what mental health issues are, the various that are there in the field. So Fred?
Yeah, thank you so much, Mal, and thank you so much, Tolulope. That was a chat with the co-founder of NGUVU Health, Tolulope Ogun. I'll just say Ogun because I can say the old. Yeah, so NGUVU is a health tech startup in the mental health space, domiciled in Nigeria. And NGUVU Health is transforming how you and I can access mental health, and the solution is expanded access, which is placing mental health access literally on your palm via your smartphone. So I've been your host, local bad Fred Akwando, and my co-host is the amazing Malin Mayenga. So check out more episodes like this on Spotify at Spacer Tech Podcast and also on Google Podcasts. So
Thank you.
for the audience, stay hungry, stay amazing, stay building, stay innovating. So yes.
Yeah. Thank you, Tony. We're looking forward to you seeing the various developments you'll be having. And thank you for being on the podcast.
Thanks for having me, and it was a great one, fantastic one you guys are doing, and thanks for contributing to the community also. Thank you so much. I think that's all for me.
Okay, thank you. Bye. See you next time.
Take care.